Hi everyone. VNA's annual Art and Soup event is a true celebration of community partnerships as we all work together to ensure there are VNA nurses in every local homeless and domestic violence shelter. There's never been a more important time for VNA nurses to be in the shelters, and your support is needed more than ever. Because of the COVID pandemic, art sales and silent auction will be virtual this year, and artists have pledged 50% of their sales to VNA. Local chefs are still participating, and when you purchase your ticket, you'll receive a really cool soup passport that entitles you to free soup at every participating restaurant. We've changed our approach to this year's event, but what hasn't changed is the need for VNA public health nursing in the shelters. This program is 100% community funded, and in 2021, you're not only making a difference in the shelters, you're also contributing to the livelihood of local artists and restaurants who've been impacted by COVID. I'm inviting you to listen to our VNA nurses, and in addition to their regular work with the shelters, they've been on the front line of the pandemic. After you hear their stories, please support Art and Soup 2021, because your participation changes people's lives.
Well, the shelter nurse program started over 30 years ago, and actually it started out with one part-time nurse. To this day, we have been able to grow that program.
And the good thing about our team is there's 4 of us and we all have different expertise, different backgrounds. We can draw upon each other to help each other, to help with the clients that we have.
A lot of these clients have had either, just bad things happen to them, abuse, mental illness, alcohol abuse, substance abuse, chronic illnesses.
So often we have clients that don't have a healthcare provider. They have transportation barriers, lack of insurance. And for the VNA shelter nurses to be accessible right there in the moment in the shelter for the clients, I think makes a huge impact.
So we can sit down with them, help them identify what their healthcare needs are, and then help them advocate. Because sometimes if I just hand them a phone number, that's just another barrier. So we make the phone call, we set up the appointment.
I think COVID kind of hit us all overnight, and it impacted greatly the shelters. They had to develop protocols immediately in order to prevent large outbreaks in the shelters and keep the clients safe.
There's a lot of teaching that we do regarding using hand sanitizer, masks, and social distancing.
The numbers have increased in the shelters because not only do we have our homelessness that we usually have, with COVID, people are finding themselves maybe unemployed or out of housing.
COVID has definitely created new challenges for us shelter nurses, but we continue to stay consistent, returning to the shelters weekly, meeting with clients, and addressing their healthcare needs.
There are people that care, to help them to get the help that they need.
Working with the homeless clients is a joy. They're very grateful for the services that we're there to help them with.
Once they get to feeling better, they get out, they have more self-esteem, they get a job, they get housing, and we just see people blossom that way.
My shelter nurses are pretty amazing. I couldn't have a better group.